Again, I'm going to welcome you to the Interconnected Systems Framework, ISF 201, when school mental health is integrated within an MTSS framework. What's different? So today's session is really focusing on how we can dig into the Interconnected Systems Framework and really think about the connection between school mental health approaches and multi-tiered systems of support, and how, looking forward, what we have learned from the field and what we have learned from practice in the past couple of years, and what the new directions are in the work. So we do want to name that this is a SAMHSA-sponsored webinar, and that the views and opinions and content expressed in this presentation aren't necessarily those of SAMHSA. They are, though, necessarily those of our two regional centers. So I'm so excited to be part of the Pacific Southwest Mental Health Technology Transfer Center and be in partnership and collaboration with Kelsey Schmitz and her team at the Northwest Mental Health Technology Transfer Center. This is what we are calling the ISF West Coast Party. So we serve the Pacific Islands, Hawaii, California, Nevada, and Arizona. That's the Pacific Southwest Mental Health Technology Transfer Center. And I'm just going to welcome Kelsey, who's the school mental health lead, who serves Alaska, Idaho, Washington, and Oregon in the Northwest MHTTC. So this is our colleague Kelsey. And together, because there are so many educators across the West Coast, and we know in the country, who are doing work on Interconnected Systems Framework, we really heard from the field and also from our colleague Susan Barrett that it might be a good opportunity to ground those of you who are really engaging in this work in where this work has come from and where this work is going, which is the outcomes of our time together. So a little bit about us, myself and Kelsey. We are the school mental health leads for a new initiative from SAMHSA. So we're entering our second year. This is the Mental Health Technology Transfer Center. You've heard me say that a couple times now, MHTTC. And it's a new model that offers regional no-cost technical assistance to support the adoption and adaptation of evidence-based practices, but also other ways that we can really support the engagement and access to school mental health approaches, practices, policies, and programs to really meet the needs of our field. So both of us are the school mental health leads for our regional centers, and we really want to welcome you. If you're new to the MHTTC model, we want to welcome you. And also, if you've been on many of our things and many of our trainings and have downloaded many of our things, we want to say welcome back. Again, a couple pieces about the MHTTCs. So each one of our centers provides webinars, newsletters. We provide individual coaching and consultation and regional trainings and tools. I do want to go back and mention, if I go back to the map, that there are many of you who are maybe not from our region, and that is totally okay. I just wanted to mention that you each have your regional center, and if you are interested in getting connected with your regional center, please let us know in the chat box or in an email, and we can absolutely do that as well. I want to move into grounding us so that we can actually get to the good learning. So this is, as I mentioned, this is part 2 of a 3-part webinar series. So back in October, we got into some good learning around what Interconnected Systems Framework is. So there are some folks on the line who have really never heard of ISF, maybe multi-tiered systems, maybe a multi-tiered system, but not necessarily ISF. Maybe you are like a really embedded in school mental health leadership and championship, but really may not be familiar, again, with either MTSS or ISF, all the acronyms. And so the introduction is a really good archived space. And again, in your session handout, you have the presentations to get grounded in kind of in the language, like what is ISF? And we're going to be doing a little bit of a review this afternoon so that we all speak the same language. Today, we're really excited because we're kind of double clicking into one of the best practices of an interconnected systems framework, which is how you really do this work in leadership teams and what this looks like at district levels, what this looks like at administrative levels, what this looks like at statewide levels. And so Susan Barrett will be leading us through some of the guidelines. And then we have 2 voices of experience who will be bringing that practice to life and offering their lessons learned and their challenges and their celebrations. And then in January, we're going to be zooming in even further into 301, really thinking about what does this look like in implementation. So we have the idea, we have the team, and now what? and we'll be joined by 2 regional voices, one from Oregon and one from Nevada, in order to make that happen. Again, as we said, today's session is really to do some deep study into how to establish interconnected systems framework team that might be leveraging an already existing team. It might be kind of refurbishing a team into meeting the outcomes of your ISF work. And Susan's going to lead us through how to do that at the school or district level. Many of you might come from community-based organizations or provider agencies or different roles, and that's beautiful because that's also part of what it takes to really do this work. Our multi-stakeholders and multiple partners from different paradigms all coming together to meet the shared outcomes of meeting our students' needs. And we're also going to discuss implementation challenges, solutions, and innovations with ISF practitioners, as I mentioned previously. This work, and it's in your handout, there's also a hyperlink, but this work is based on 3 issue briefs that our center released. All 3 were authored by Susan Barrett and her colleagues at the OSEP Technical Assistance Center on PBIS. And so there is a fact sheet to help us guide through this work, and much of the content will be based from today will be based on the fact sheet that's in your handout box. We're going to start with defining the interconnected systems framework, like I mentioned earlier. So Susan will be, if you weren't able to be with us for the 101, Susan's going to ground us. And then we're going to go through how each MTSS feature is enhanced and positioned within the ISF framework. So we're really going to see that alignment and that leverage and liftoff, and then we'll close with next steps. So without further ado, many of you know Susan. Susan will be introducing herself, but we just want to say that we're so incredibly thrilled to have Susan guide us through this work. She's the director for the Center for Social Behavior Support Center. And I do want to say that there are probably many folks on the line who have received Susan's training in person. She's an incredible trainer and facilitator and one of the national leaders in this work. And so we're really excited to have her. And like I said, we're really excited today to have 2 voices of experience from the field. Tani will introduce herself also. So Tani comes to us from Washington State. We'll be learning more about her work later. And our last but not least voice of experience is Natalie, coming to us from California, who will also present her lessons learned and challenges in really lifting this work and bringing this work to life. So without further ado, we're going to hand over the mic to Susan Barrett. And we're so excited to have you on, Susan. The floor is yours.
Great. Thank you, Leora, and welcome, everybody. Really appreciate your time in joining us this afternoon. I'm going to do a very quick setup so that Natalie and Tawny can come on and talk about their experiences working with ISF. So if you joined us the last time, you got a pretty in-depth overview of what ISF is. And we know that redundancy builds fluency. So thanks for sticking in with this kind of rewind. I'm going to quickly go through kind of what ISF is and the idea behind kind of how we've launched it from the foundation of PDIS. So ISF is really about the deliberate application of the multi-tiered PDIS framework. And we're really trying to harness all of the social emotional behavior interventions under one single system of delivery. Right now, MTSS, multi-tiered system of support, is getting a lot of traction in the field. And I fear that we are still siloing efforts while we're getting better at putting systems and structures in. I have a worry that we're still siloing our efforts moving forward, especially as it relates to building single systems of delivery with our community partners. ISF is also really about the active participation of family and youth. It's really a central feature, and we're really using those systems of care values to bring into the work here. So to operationally define this, it's really a structure and a process. And I want to make sure that folks understand that we're talking about huge structural changes and systems changes that can often take years to kind of develop. And so I want to make sure that you understand how much work is involved with this, that it really takes time, space, and support for folks to really unpack what it looks like and sounds like in their system. And so one of the reasons I've fallen in love with kind of this systems change and this implementation design is because of its flexibility, and that the people, the stakeholders who are working inside the schools and inside the systems really bring this to life through the culture and context and through their lens. And so I want to make sure that you understand that there's no one size fits all, that this is a structure and a process that really guides key stakeholders who have the authority to make some really core decisions around changing role and function of staff, changing policy, blending funding streams. We really need those people at the table, but we also need our families and our children and our youth to guide this work as well. It is a heavy lift, and it does take a significant amount of time. So I just want to make sure that we set that up. A couple of the benefits that we're seeing, we just finished our first randomized control trial, and it's really exciting to see some of the benefits in real time as we compare ISF to some of the control schools and control conditions in the systems that we were working with. And one of the things that we're seeing is that we're uncovering students with mental health needs earlier. And this is really significant because we know that there is an 8 to 10 year time frame by which symptoms start to show up and students and youth and children are getting interventions. And so the idea that we can uncover students earlier and make sure that we link them to the evidence-based interventions that match their need is a really, really important improvement based on kind of status quo, if you will. We're also seeing systems really use data tracking to make sure that we're showing improvement. We're seeing expanded roles for clinicians to support the adults in the community. So there's this really big push to focus on teacher wellness, on clinician wellness, to make sure that the adults that are supporting the students in the environment have the bandwidth and have the skills and knowledge, but also have mental health themselves. And so we're really focused on that and really expanding the roles of clinicians to do that. And then finally, one of the benefits is really this healthier school environment, really making sure that that host environment can meet the needs for all within the community that they're serving. And so the idea that much like PBIS and MTSS, we're really focused on kind of the universal precautions and making sure that we have our adults, our children, our youth, and their families living in pro-social communities, living in places where there are important and critical partners that have nurturing, loving, preventative kind of approaches. So I know that a lot of you are familiar with the data across the country, and we just wanted to pull this together. This comes from NAMI, and they have some brilliant infographics that are useful when you're trying to draw other stakeholders into this work to kind of tell the story about kind of this mental health crisis across the country. I already mentioned the average delay between onset of symptoms and intervention is 8 to 10 years. But we also know that 50% of all lifetime cases of mental illness begin by age 14 and 75% by age 24. We have 37% of our students with a mental health condition age 14 and older dropping out of school, and that's the highest dropout rate of any disability group. And then finally, 70% of our youth in state and local juvenile justice systems have a mental illness. So we are literally incarcerating or putting kids in jail for having a mental health condition. And so I'm sure that you're familiar with some of the national trend data, but I urge you to become familiar with some of the local data that will help drive some of the stakeholder engagement and help us rally around specific data points that we're all really trying to change. We know also from the data that because of the magnitude of the problem, we can't continue to do business as usual. And so it's going to be really important that those people, those teams that we're going to be describing for you in a little bit, really have the authority to make some really big decisions around how to reshape the host environment, how to reshape the way of doing work so that we can meet the needs of most of the people that are living within that system. And right now we simply are shortchanging our community because we aren't looking at data necessarily in the aggregate, and we don't have a team approach that's really focused on sorting kids by groups. We tend to individualize really quickly. And so the idea with ISF is that we're going to spend a lot of time building the best instructional practices at tier 1 that support social, emotional, behavior, and academic needs for all. And as that starting point, we're then going to create the conditions that we have less children and youth who need additional support. So here's the big question at hand. What if making our environments more nurturing could guide us in preventing almost every problem we face? And so this really comes from the work of Tony Biglin and the Nurture Effect and the books that he and his colleagues wrote and all of the research that Tony has really led in prevention science. And the idea is that we actually know exactly what to do and that pro-social communities can really help counter the ACEs scores that we're seeing within our communities and counter that data that I was just kind of going over. And so as a way to kind of enter into this space with ISF, just to let you know kind of the historical background of how we have evolved over time, we really start with PBIS as the core foundation. And what PBIS did was it set in motion an implementation framework where we had teams across the cascade of implementation. We had teams at the state level, at the district level, and at the school level who were really trying to organize their resources so that kids could get help earlier. They didn't have an opportunity to fail for very long. The team also invested in stuff that was likely to work. And with PBIS, you know, if you've been a part of it, that we've also really engaged in making sure that our staff are getting support to be able to implement with Fidelity. And we track implementation of Fidelity through something called the Tiered Fidelity Inventory. And that really allows us to make sure that we are holding ourselves accountable to fidelity and high quality implementation of evidence-based practices before we assign blame to kids for not succeeding in those systems. With PBIS, we also make sure that we're continuously successful through coaching, through progress monitoring and performance feedback, through a problem-solving process across the tiers of support, and that we always are increasing that level of intensity and making sure that we're not skipping over tier 2 and moving to intensive levels of support, but we're really trying to do the lowest level of intensity that will have that outcome that we're seeking. So ISF really has its foundation in PBIS, and we also know that there's evidence of impact with PBIS, which is why this is really built on that as the backbone. And so as many of you know who have been implementing PBIS, there's a lot of evidence of impact around improving academic achievement, reducing student discipline, specifically office discipline referrals and suspensions, and improving social emotional functioning. So we're really seeing PBIS as kind of the tier 1 school mental health initiative that gets us started. But we also know that many schools are still really struggling with tiers 2 and tiers 3. We have a lot of our schools that have youth with internalizing issues, and they're going undetected. We don't have enough staff and resources in our schools to be able to deal with the magnitude of the problem. And then although I know we're showing success in social climate and discipline, we're not really addressing the broader community data where we could really have a wonderful advance notice of things that are coming to us so that children never have an opportunity to fail in our systems, so that we are much more compelled to think about it in having the surveillance mindset, really, where you're looking to the community demographic data to really unpack what's needed and planning for that before kids show up at the school door. And so we know more is needed. And so with ISF, we knew PBIS had a really good running start, but we knew we needed more. And so we reached out to our school mental health partners and the Center for School Mental Health and Mark Wiest and Nancy Lever and Sharon Stephen and others. We looked at the system of care research. We looked to our friends in the implementation science domain, and we really wanted to capitalize on bringing all of these things together under the ISF umbrella. And so we are building on the success of various social service platforms, but we also knew that we needed to have very specific steps for integration and alignment because this work is so challenging, right? We're asking people to really take an honest and transparent look at what they're doing and abandon these long-held patterns of doing business to create new models that are built on the strengths of the community that they're working in. But this is hard, right? It's hard to give up something that you're doing. And so we kind of are trying to rally around all of the best practices and really offer some really specific strategies, specific steps. And so we'll talk about some of those resources in a second. because I think we're really doing a better job of scripting the moves for the communities that we're serving. So a couple more slides just for the setup. There are 4 critical key messages with ISF. One is that we have a single system of delivery where we have one set of teams. Too often we splinter our impact when we have a large number of teams operating within the system. And so oftentimes a shiny new initiative comes to our system, we form a team around that. And what's ending up happening is that we are really splintering out and siloing our efforts when we don't have one set of teams that's really focused on the structures and the systems that are shaping the behavior of the adults within that community. 2, access is not enough. We really are defining our success by the outcomes and what's occurring in terms of student and youth benefit. We would never count the number of kids that are accessing a reading program as an impact data point. And yet too often with social, emotional, and behavior, we are counting the number of kids who are accessing services. And we are finding that those terms are really just too general, and that if we're not anchored on really specific outcomes, that's really not quite enough. Number 3, mental health is for all, right? I often ask when I'm working with teams, how many of you all have mental health? So it's important that we all have the necessary social emotional skills to handle life, but we also really need all of our adults, our caregivers, our education and clinicians to really be mental health ambassadors. And then finally, MTSS is really essential. Those core features are essential to installing a school mental health approach. And just to remind folks of what those MTSS features are, we really promote that everything we do is delivered through an effective team, that we not only look at school level data, but we look at community data, and we use data to make decisions together as a team. We really want to invest in having a formal process for selecting and implementing evidence-based practices. Again, too often we're trying to take on too much, and in doing so, we're really preventing our ability to work effectively and efficiently. We want to make sure that kids have early access through a comprehensive screening approach, and that we use rigorous progress monitoring for both fidelity and effectiveness. And then finally, that MTSS core features that we have ongoing coaching. Too often when we put training events together, we don't follow it up with coaching and technical assistance. We don't follow it up with performance feedback measures. And so to what extent are our teams putting those structures and processes to make sure that our staff are getting the kind of supports that they need? With this graphic, the big takeaway here is that teams are vital, that they're really the core, the backbone of what we're doing in ISF, and that teaming structures occur across the cascade of implementation. And today we're going to focus on the district leadership team, because that's really that critical piece for supporting the school level implementers. We would never ask school level implementers to take on the alignment and integration, and we're really relying on those people at the district community leaders who have the authority to change some of those systems, to really create a strategy for how they're going to support the schools moving forward. And so feature 1 is really this integrated teaming process, that single set of teams, that we are making sure that it starts with the district, but then we model and shape those same procedures and routines at the school. And that across that integrated process, we're including our community partners, we're including our families and students, not only as representatives, but as very clear leaders, which means we have to very clearly define our roles moving forward. So that's one feature. The second feature, and you can see that these features line up exactly with the MTSS core features. We're just taking it kind of a step further. With feature 2, we're really wanting our teams to make decisions by not only using their school data, but by using their community data. And in this way, we can set the stage for having that community context. The leadership team will continuously review relevant community data and continuously adapt to make sure that it matches the needs in their specific community. Feature 3 is all about that selection of evidence-based practices. Unfortunately, there's still too many things that we put a lot of money behind and a lot of resource and time behind, but we haven't done our due diligence at that core team level of really rigorously studying the extent to which the practice or the intervention has evidence behind it, and to the extent to which it actually matches the specific needs of our population. And to what extent does that evidence base really serve our unique population and our culture and our context? So one of the biggest, most rigorous pieces within the teaming process is really to put a formal structure for making these decisions together as a team. We also want to make sure that it's just not one person making decisions, but it really is a team unified approach. Too often, again, we're bringing this siloed approach in when we hire a clinician to come in and then they alone decide what to do with the students that they're serving. The change here is that clinicians are now serving on the teams with us, and together as one unified team, we're making decisions about what evidence-based practices we will adopt across all tiers of support. Feature 4 is really about that comprehensive screening for early identification. And so my big utopian reality is that I wish that we could screen every single student in this country the same way we screen hearing and vision. If we could uncover the needs of our kids earlier, we're going to have a much greater impact on our ability to put in accurate resources. So this idea that the team identifies a universal screener that can really uncover the needs, both internalizing needs and externalizing needs, and then in that way we can link them to the appropriate interventions. Along with this is the idea that it's not just comprehensive screening data that we need, we really need to triangulate the other data sources that we're bringing together. We've got feature 5, tracking fidelity and impact. So again, in an integrated system, the interventions for anxiety and depression and trauma are monitored with the same rigor that we apply for reading and behavior interventions, and that we hold ourselves accountable to that high quality level of implementation. And then within the teaming process, feature 6, one of the structures that we're really trying to put in place is this coaching and building the local capacity for local coaches to ensure that this work is done with fidelity, to make sure that we make this feasible, that we make this realistic, and we put feedback measures in that let us know when we're doing things with high quality, and then we have an opportunity to adjust. So really kind of setting in this culture of support and culture of coaching within the unit of the system. So before I turn it over to Tani, I just want to pause. I know that was really the fast way of moving through an orientation to ISF. It would be really great if we could hear from you all who are listening in today and lean into what your experiences are out in the field and learn from each other. We'd love to hear any kind of ideas that are spinning around or any kind of takeaways or ahas at this point. And I'm seeing folks type right now. Thank you very much, Richard and Shelley. Really appreciate you putting some comments and words into the chat box. And I want to turn this over to Tani and invite Tani to start us off.
Okay, well, this is Tani Barlow. Great to meet everybody. I come to this work pretty passionately. I spent about 16 years in the Department of Corrections, and then I spent 2 years in social services as a CPS social worker. So when Susan is talking about that access is not enough and mental health for all, I really come at it from that lens, as well as to interrupt the prison pipeline, because I spent a lot of time there, and I'm hoping to really do some work with whole family education and whole child access and help, because again, to reiterate what Susan's talking about is that mental health for all, and we really are intervening at that level. So I feel really lucky that we get to do that. I would say that for the Medical Lake School District, we started building an MTSS team about 5 years ago, and this work is hard. It takes a long time. We really started looking at it from a PBIS and an academic model, and then we're fortunate with our school board and our superintendents, our administrators, our educators. Everybody is seeing mental health as a need, and so we were able to start to fold in that work. The slideshow that you're looking at is really one of our multi-tiered systems of support, which now includes behavioral and mental health. So our district as a whole, we're working on 3 goals, and you can see them up there, and one of them definitely is to partner with not only our local educators as well as community partners, and we're attempting to build our multi-tiered systems of support, but build it with mental health, and then do that by improving outcomes not only in education, but behavioral, mental health, drug use, social outcomes, because again, not doing this work, we've seen some pretty big impacts in the prison system as well as social services. We took our already existing multi-tiered systems of support, and this is where we added in our mental health. So people say, what's the tier 1 work that you're doing around mental health? So when you look at this graph, you can see these are the tier 1 implementation or strategies that we're using. You can see that it's talking about universal screening and break rooms. Not only are we looking at for students, but we're going to add in there also for staff. We're doing some Mind Your Health psychoeducational newsletters, some classes, which has been awesome to provide education not only for our educators, but as well as for our community and family members. Now when you move into tier 2 and tier 3, you can see where our mental health and our therapy really increases. At tier 3, we're utilizing a lot of our community resources as well, so we're really partnering not only at that district level, but as well as at the community level that Susan talked about. So we were asked to share 10 celebrations as well as some lessons learned. I can tell you that it's fun to write the celebrations and the work the team here has been working on. We easily could have written not only 10 celebrations, but 10 lessons learned, maybe even more, 20 to 10. But it's fun. We get to list the 10 that we're celebrating and then a few lessons learned. But know that this work has been long, arduous, rewarding. We've gone home tired some days, and I feel like I'm speaking for the whole team. It's been great, but hard work. Number one of our celebrations, lessons learned, is we had principals and teachers talk about what's the impact been since we've implemented this work. We did have a local school, so we're in Medical Lake, Washington, which is really close to Spokane, Washington. And we had a local school from Spokane, Washington come out and talk with our mental health team and say, how do we do this? Because we'd like to replicate this work. It was interesting to hear the teachers and the principals say, since we've implemented this mental health work into our tiered systems, we've seen a decline just in our office referrals. The principal said, his students that typically are in the office, at about 15 to 20 students waiting in there, down to about 3 or 4, that he was just really dealing with the discipline issues versus just the mental health issues. So it was great to see that the great work that the team is doing, that it's showing. So typically we were seeing about 30 referrals in a month, and it dropped down to 10 referrals that they're seeing in a month when they're looking at their Swiss data. The second celebration that we have is this system, the mental health system, we folded it into our already existing system, because a lot of times you'll hear people say, another system or another acronym. What was really nice is that we're not coming up with another acronym, that we're really just folding in our already existing infrastructure and adding in the mental health piece. So with that celebration, we did some resource mapping on all of our evidence-based practices. And usually when we do this presentation, we have lots of people come up and say, hey, can we have just that one slide? So we have a whole list of slides, and I know Kelsey Shimmis will be able to post that for you, but it's a whole list of all of our evidence-based practices in a tiered model, so where we're looking at academically, behaviorally, social, emotional, and mental health. So that was a great celebration. The team did really great work with that. The other thing that was a great celebration is looking at the school counselor model. So those of you might be familiar with their ASCA, their School Counselor Association model. And a lot of times you see school counselors doing more of the paperwork and scheduling, and where they're tracking their test coordinators. And our district, our school board, and our administrators, they really took a look at with the school counselors on the work that they're doing. And they were able to take away some of those paperwork type duties and really got into some direct service duties. So that's been a big celebration for our school counselors. And there was an article shared by Harvard, and we took a peek at it and really saw the school counselors as the hub where this mental health system starts. So the school counselors are really taking this, any of our referrals, and they're the ones that move this out to those different tiers. They also, in one of our schools, they created what's called a Cardinals Nest. And with that, they have a calming room. They're running several groups. There was a group in there this morning working on self-esteem. So we're hoping to take that model and move it out to all of our schools. We have 5 schools in our district, and create one of those calming rooms not only for staff, our students, but for staff as well. The other celebration was number 4, where we talk about the immediate response. Again, the administrators and educators are talking about having mental health within the school system has allowed for them to have immediate service, immediate response, where before sometimes schools, they weren't even getting a response for a day or two, and we can immediately respond having mental health embedded into our schools now. So it's pretty cool when you have a threat assessment that we can immediately create a safety plan and get safety and supervision and support for the student and the family right away. And then somebody to help process this. During threat assessment, dealing with suicidal ideations can be scary for families, and so it's nice to have this mental health that already embedded into our system that we have. And the other win, as we talk about mental health and for all, is having mental health embedded into a school system. It allows us to serve a variety of populations. So you can see on number 5 that we're able to serve students maybe that they make just enough money to not be able to afford services. I'm sure you've heard of people in the bubble like that. You know, as we talk about Medicaid, a lot of times people with Medicaid can get services but may not know how. People that don't have Medicaid can't get services. Military family, one of our schools is on the military base, and sometimes they may not access services for a variety of reasons, so they've been able to access those services in our school system. And really, the big celebration right there is that third bullet where it says free services for all. And so when I talk about interrupting the prison pipeline, that's really key, is having services for everybody, even the community. So that's not an error when you read that students, families, and staff. So we are serving not only our students and families in the community, but we are also serving our staff. I was walking through a high school this morning, and a staff member came up to me and said, my son is really struggling. Well, can I get services for their son that's within our district? And I said, absolutely, this is how you do it. And so it's just so great to have those services readily available. Another celebration was PAL, which is Partnership Access Line. So we were able to work with Seattle Children's and the UAW, and which gives us really an access link to the psychiatrists and the psychologists as we are teaming and working with kiddos who have significant needs. So that's been very helpful. And I talked about the mental health literacy, and the great thing that this great team has created is not only are they producing a mental health newsletter every month, but they are also producing sometimes 2 times a month or 3 times a month psychoeducational classes that staff and community members are going to, and we're getting a really great turnout. We've been assisting several different school districts. One is the Central Valley and Forks School District. The last one is we've been receiving lots of support through our community providers. So, lessons learned, like I told you before, work has been long and arduous. We've been building as we go. So I would tell you some of the lessons learned. We're developing onboarding training as we're going. And so last year, it would have been nice if we would have done that in the beginning, but we were building as we were going. The other thing to think about as we've put mental health services into the system is looking at space, funding, furniture, kind of the logistics, equipment, phone. It would be nice to get that, to have had that done beforehand. And then the other thing is if we were to outline everybody's jobs, because again, building as we go, sometimes there's some crossover. So it's a good idea if you're implementing to try to get it outlined beforehand. Would I change anything? It would be nice to do those things ahead of time, but no, because at least we're lifted off and we're going and growing. So with that, I'm going to introduce my counterpart, Natalie, from California.
Hi, thank you, Tony. Thank you, everyone. So Natalie Sedano, Prevention and Intervention Lead Specialist with the California Association of Health and Education Linked Professions. It's really a JPA, and that really does encompass our Desert Mountain SELPA, our Desert Mountain Children's Center, and then our Desert Mountain Charter SELPA. And so especially when you think about SELPA, it's Special Education Local Plan Area. And so we are really unique in that we encompass PBIS, or Positive Behavior Intervention Support. We are a Technical Assistance Center. And so a lot of our LEAs already have some form of implementation of PBIS, which is really helpful as we move forward with then implementation of the Interconnected System Framework. And what was really nice is we received recently a grant through the Mental Health Services Oversight and Accountability Commission. And really what the grant is saying is you have the foundation laid of PBIS, and so now how do we continue to build on that now with looking at mental health supports. And so it's just been a great endeavor as we move forward, and I'm excited to share those 10 celebrations, and I'm also in agreement with Tani. We can look at some barriers and things and roadblocks, but all that to say it was a really nice reflection of what this year has entailed for us, because it's always nice to have those moments of, okay, pause. Even though this work is arduous, and you are right, it is difficult, what does that look like in terms of our families and our students, and above all, what does that look like for folks in our community? And so get started with those top 10 celebrations. Essentially with this grant, it began with meeting at the district, also with our preschool program leadership, because we know to sustain work, especially when we talk about our PBS blueprint, it really does begin at the district level. So we met with our 19 LEAs who are part of this grant, and essentially we covered some key pieces with them. Susan did mention the tool, the Tiered Fidelity Inventory. We made sure we encompassed that and looked at data, because data will get us far. We then looked at the ISF Appendix A, or the Survey on Readiness, which is really helpful in connecting folks with the idea of, well, what is this? What is this ISF? Because of those many acronyms that are out there in education, as we all know. And so having that as our go-to, kind of looking at what does that really all mean for them, was really insightful. We also talked to them about universal screening, and some folks, especially preschool, are really good at this. They typically have used the Ages and Stages questionnaire, as well as Ages and Stages Social Emotional questionnaire. And the other tool that's noted in our grant specifically is the Student Risk Screening Scale, internalizing and externalizing. And so having those conversations with our LEAs, with our preschool programs, was really helpful in the deciphering what they currently have, because we want to make sure we're doing that and not making it feel like it's another something. And so those conversations really kick-started our journey, as well as really establish already relationships that we do have. So again, having relationships is pretty key as we move forward with our journey of the ISF. Other things that were really helpful is that we were able to build capacity. We looking at further supports, because this grant we received was a personnel grant. So we were able to hire more folks to really provide more of those trainings, more of those supports and coaching. And so those are just a few that we were able to provide, learning and understanding students from diverse backgrounds, trauma-informed care, really more focus on social-emotional learning. Next piece was getting to know your needs survey, which may seem silly, a survey, but in addition to it was really looking at what are the needs of our community. And I'll talk about here shortly, that was something we really were excited about this grant, is we have an outreach team that essentially is really focused on reaching out to families and community partners, and so that's been a really great endeavor to be a part of. It also helps us create additional interdisciplinary teams, and so essentially we have an early childhood trauma-informed PBIS team, which really consists of our PBIS specialist, intervention specialist, program specialist, and our clinical program manager. So essentially it's about looking at what all these layers of support and expertise really can bring for some preschool programs, as well as looking at further supports for our school sites. Other things that have been really successful, our ability to really provide more family engagement and, again, community outreach opportunities. And just to highlight, we've had 504 outreach connections. So It's the ability to bring people at the table who typically wouldn't be at that table, right? To really link, provide trainings, and to host some family fun days just to really encourage that family engagement. So again, we have a great opportunity, a team that's able to do that. The next component, when we talk about interconnected system framework, it's only at the school sites, but also within our organization, how we were able to build those collaborative efforts amongst ourselves. And so it's the idea of us coming together and saying, hey, what is it that we're already doing? What is it that we can build upon to really outstretch ourselves and really to build this interconnected system framework for all? Other pieces that have been celebratory is exploration and installation process of universal screening. I've noticed that some of you have been asking, well, what tools are used? And it really depends on school district, really. Where are they feeling it's appropriate, or where are they feeling that would be the best tool for them? The tool that I specifically noted, the student risk screening scale, is free, and it puts it back on the teacher. And there's tons of information available about that particular tool. Ages and Stages questionnaire is a developmental screener, and so that's typically 0 to 5.5. And it's, again, a really great screener that parents can do. So essentially it's doing hands-on activities with the families to gauge kind of where their student is. And so those two have been really taken off. And actually we met with a district today who's really looking at implementing the student risk screening scale, but going slow to go fast. And they are electing to start maybe with the cultural responsiveness training first, right, to make sure we're all on the same page. And so then they'll move with the student risk screening scale. Other pieces have been ability to connect, as I was noting, with other agencies, which has been great because we're able, again, to build not only our internal support, but also gain knowledge of what other things are available for our families in the high desert. And that's where we're located, so my apologies, I didn't note that, but we're maybe 2.5 hours away from Vegas. It's probably easier to note that, but just the idea that trying to build resources up here for our families. The other thing has been identifying ISF entry points. So the idea that PBIS is happening in various stages, but it also really is a reminder of our district commitment to what that does look like, and they've been on board. And so that's also then with an alignment of celebratory pieces. So the California PBS Coalition Recognition System and those celebrations that have really built momentum for schools to continue with that work. Other things have been really the ability to move beyond training, application, and implementation. So some of those trainings, just to name a few, are things that are really happening internally to our team. Just some quick lessons learned: go slow to go fast. Definitely having still continued conversations around team structure, the common language, reminding ourselves it takes time. As you all may know, it does take time to kind of look at this work. And with that, just making sure we have a clearly defined action plan moving forward. Again, it's just a lot of learning. A lot of things have come down our way in terms of noting it's really a single system of delivery. So I'm going to pass it on to Leora.
Thanks, Natalie. I want to just remind everyone that you do have the slides in your handouts, and there's a lot of rich information that Susan, Tani, and Natalie have put forward. And I don't want the recommendation to promote wellness, and then also to be patient and kind around time to enact systems change, and also Natalie's identification that having a clear action plan to move forward is really essential. So I'm going to encourage Susan and Tani and Natalie to take a deep breath, and also encourage those of you who are on the line who have been really digesting the incredible amount that has come our way, to take a couple seconds in the chat box to name one aha or one takeaway that you heard in what Tani and Natalie lifted up in their practice. As you are putting in your ahas, we want to lift up that it is about systems change. That is what ISF really brings to light, that it's about aligning initiatives and resources. So we heard both Tani and Natalie talking about how do we already identify what's in place and elevate. It's about creating shared language through education, and then also providing socio-emotional learning support for teachers and their own wellness, and then being data-driven. So I know that you've got a lot of folks are writing in the chat box, right? We've got using screeners, providing counselors, but I also really want to recommend, especially with all the hiring and screening, that we want to adopt slowly and interrupt quickly. We really want to be careful and mindful, and I do want to lift up that our MHTTCs and Susan, and our two Voices of Experience are here to really provide coaching and thought partnership if you're interested in that moving forward. We are lifting up common themes and takeaways, and I want to encourage you to continue to put them in the chat box. And we are closing. I do just want to invite you to join our 301 that will be about implementation. And I do want to name that we are thinking about having a kind of virtual learning of practice, because I know a lot of you, like 1 hour is not enough and there's so much learning. So please keep your eye open for that. Next month, we'll be focusing on Oregon and Nevada practitioners, with Susan leading us through implementation. And I do want to encourage you to join us if you are interested in coming to Long Beach for a no-cost 3-day institute, and you've got the link in your inbox if you'd like to check out, come to us for 1 day or all 3 days and be engaged in learning. And you're more than welcome to please join us as the Pacific Southwest and Kelsey and team in Northwest, and everything will be sent to you. And I just want to thank Tani and Susan and Natalie again for this really rich hour, and encourage you, if you have questions or resources that did not get met, please email us and we will be sure to do that. And again, thank you to Tani, thank you to Natalie, thank you to Susan for taking the time and being vulnerable and sharing your voices of experience. And I want to appreciate everyone who joined us for this hour. We will see you in January. Thank you so much, and we will see you soon.